Committee on Finance will come to order. Members, we have Senate File 720, Senator Dames in front of us. If you would like to give just a brief summary of the bill, that would be great.
Thank you, Madam Chair and members. I appreciate the opportunity to present Senate File 720. Madam Chair, there are two amendments. If you would please move those, and I can go ahead and explain the bill.
Bill, Senator Dames, we are going to first pass them out. I'm going to get Benson back. Yes, Senator Dames, which one would you like to do first?
Just you can do them just in order, Madam Chair. It would be the A21 and the A22. Either one is fine. Do the A21 fine first. Be fine.
Senator Benson moves the A21 amendment.
Madam Chair, the A21 amendment changes the constitution of the board just slightly. Right now, the board, let's see, as I'm reviewing the A21, okay, it places two directors appointed by the Commissioner of Human Services from the hospital, one from the hospitals, and one from the healthcare providers. Because of the source of funds that we're using, it's appropriate that those people who pay into the Healthcare Access Fund would be appropriately represented on the board. The third provision, enrollees in the individual market, this is not a material change, Madam Chair. Previously, you had to be enrolled in MSHA, but because MSHA as a product specifically isn't going to exist anymore, we're shifting it to the individual market, so people who would be enrolled and benefiting from this reinsurance plan.
Thank you, Senator Benson. I have a chance for everybody to see it. Senator Dames, would you like to comment on this amendment?
As Senator Benson said, it just changes, basically the major changes, taking the two members that were supposed to be from the MSHA enrollees, switching that over to enrollees in the individual market would be the major change.
Any further questions, members? Senator Champion, thank you.
Thank you, Madam Chair. And to Senator Benson, I'm not on any of the healthcare committees, so can you help me understand why you are proposing this now after it's already gone through, I would naturally assume, your committee, because this appears to be a change that would be significant enough where your committee would be able to discuss whether putting individuals enrolled in the individual market on the committee.
Senator Benson.
And Madam Chair, actually, the provision that had the most significance and was introduced in committee was that the Commissioner of Commerce would appoint a member representing the hospital and a member representing the healthcare providers. I asked that it be amended to the Commissioner of Human Services make that appointment, and so that's the first part of the language. But the enrollees in the individual market versus MSHA is I would say, a distinction without a difference. We want someone who's receiving the product on the board as it was previously constituted. And so we're just making sure that the individuals consuming the product can continue to be represented on the board with the third part of the amendment.
One last question,
yes, sir.
Madam Chair, and maybe Senator Laurie can help me with this. So, Senator Laurie, do you see this as an insignificant change? Because I'm not on any of those committees, so that would just be helpful as well to get your input as well.
Thank you, Senator Champion. Senator Laurie.
Madam Chair, this is actually something that we did talk about in the Health Committee, and the Commissioner of Commerce, Commissioner Rothman, did say that we would need to address this additional part about there are no more MSHA members, and so we needed to replace those two. We weren't ready with language right there, so I mean, I do see this as a cleanup. You will see in the engrossed a part of the amendment that I offered is here where providers are on the board. That was actually objected to a little bit, but it did go on. The point behind that is, you know, we have $300 million going to the health plans, and how it was originally structured was just to allow them to kind of decide how that played out, and really didn't respect the issue that it is the providers that put in most of the money that is being taken in order to fund this. And so we did add the providers, but we had this cleanup left to do, and so that's what you have in front of you.
Great. Further discussion? Senator Benson renews her question on the motion that the A21 be recommended to pass. All those in favor say aye. All those opposed, no. Amendment is adopted. Members, we have the A22 amendment being passed out.
Madam Chair, I'll move the A22 amendment.
Senator Benson moves the A22 amendment.
And
Senator Benson?
Madam Chair, I'm going to phone a friend and ask Mr. Nauman to walk through what the language changes imply for the fiscal portions of this bill.
Very good. Mr. Nauman.
Mr. Chair and members, this is mostly a money amendment that just makes a few changes to some of the resources and expands them somewhat. Lines 1.2 and 1.3, I understand, are technical. Lines 1.4 through 1.11 sets the order of use of resources with the general fund, because being the last in line. There is an order in the bill, and I think that Senator Dames will speak to this in a few moments, of which resources would be used. And lines 1.8 through 1.11 specify that any general fund money that is left be returned to the budget reserve. Lines 1.12 through 1.20, through the balance of the amendment, transfers additional money from the budget reserve into the reinsurance account in the special revenue fund, but it does so by first transferring it to the general fund and then making that transfer out of the general fund.
Senator Dames? Any comments on the A22?
Yes, thank you, Madam Chair. As Eric or Mr. Nauman stated, it does outline the process for how the money would be spent. First, we would spend the money from the 1332 waiver, if that waiver is granted, which we feel fairly confident that we'll getting some information from the Commerce Committee and their confidence on that. Then the second piece would be the reserves in the MSHA account would be spent next. Then the money from the Healthcare Access Fund, and then the money from the general fund would be that order. And that's why we're seeing the transfer from the reserves into the general fund, and then the general fund into the reinsurance fund in the special reserve fund.
Senator Marty and then Senator Lori.
Madam Chair, Senator Dames or Senator Benson, so in other words, after those first two sources, it would be $180 million from the Healthcare Access Fund, and then if that's not sufficient, $120 million, this new $120 million on top of that from the general fund, and if that's not spent, it goes back to the general fund. Is that?
Goes back to the
Senator
general.
Dames.
Madam Chair? Senator Marty, yes, that would go back to the general fund.
So,
Senator Marty.
And so, Madam Chair, so it would be outside of the first two sources, it would be with the reserves, the leftover from MCHA and whatever we get from the feds, it would be $300 million a year then total?
Correct.
Senator Dames. Senator Marty? No? Okay. Senator Lori.
Well, Madam Chair, I think it's not quite correct. It's not just the general fund. In line 1.16 there, it's first coming out of the reserves into the general fund, I think, as I read this, and then from the general fund. So in essence, it's taken from the budget reserve. Is that, am I correct in
Senator
that?
Dames.
Madam Chair and Senator Lori, yes, and I apologize, I thought that we had explained that in the discussion on the amendment, but if I didn't, yes, it does. It comes from the reserves. From the reserves, it gets transferred to the general fund. From the general fund, then it will be transferred into the reinsurance fund under the special account fund, and then it would be the order that I prescribed in the bill here, or in the amendment.
Senator Dames would go from the general fund to the reinsurance account and then into the special revenue fund.
Correct.
Yeah. So, Senator Lori?
So I think Senator Cohen was next. I'm going to think a little bit about how
Okay,
this
Senator Cohen?
works.
Well, Madam Chair, Senator Dames, so now the intent of this bill is an ongoing bill, is it not? This is not an emergency like the previous bill, the healthcare premium bill we had.
Senator
This-
James?
Thank you, Madam Chair, and Senator Cohen. This bill is set up, this bill is funded for 2 years.
Well, but
Senator Cohen?
everything we, Madam Chair and Senator Dames, everything we do is funded for 2 years. So would it be your intent to have this continue into the next biennium, depending on what happens with this reinsurance plan and depending on what happens out of Washington?
Senator James?
Thank you, Madam Chair and Senator Cohen. My assumption is, depending on what happens in Washington, if everything would stay the way it is today, then that we would continue this and we would be funding it in the future. At this point, we don't know what's going to happen in Washington, so we've looked at funding it for 2 years and putting the plan in effect. However, if things don't change, then we would be probably moving forward to fund it again, yes.
So,
Senator Cohen?
Madam Chair and Senator Dames, understanding that everybody is uncertain as to what happens in Washington and we don't have any guarantees in any respect of what may or may not happen, it doesn't matter which party's in the majority in Congress or has the presidency, there's always that uncertainty. Obviously, I am concerned as I look at the amendment as to the funding source. Madam Chair, if I could just inquire of Mr. Naumann, assuming the A22 amendment passes and becomes part of Senator Dames's bill, the Senate File 720, and that ultimately 720 becomes law, where are we with the budget reserve?
Mr. Naumann?
Mr. Chair and Senator Cohen, Madam Chair and Senator Cohen, the budget reserve would be a little over $1.4 billion.
So,
Senator Cohen?
Madam Chair, if I might just make a comment. I realize budgeting is not easy, but when we start budgeting for ongoing purposes out of the budget reserve, that raises all sorts of red flags. Even if we budget on a one-time basis, it raises some concerns. I raised the question on both in this committee on the floor relative to the utilization of the budget reserve with the prior bill, with Senator Benson's bill. Having said that, there might have been more justification because of the emergency nature of that legislation. This is obviously an important issue and an issue of concern to all sorts of folks around the state. But I do raise the concern about the utilization of the budget reserve. Apparently this committee, Senator Dames, you don't belong to you're not a member of the committee, so you didn't get a chance to hear the discussion from Dr. Klimakidis when she talked about the budget forecast. And I asked her, I think a couple other people asked, what happens if? And how much, to what extent can we depend on the forecast and the IHS economic projections? And she said, if you believe that this, and this is going to happen, then you could have some certainty with this forecast. The what ifs were all the same what ifs you're discussing, Senator Dames. What happens in Washington? What passes out of Washington? Her comment was kind of the flip side of what you're suggesting, to the extent that if some of the things don't happen in Washington, as discussed by the IHS economic forecast, we'll find ourselves arguably in a budget deficit. The reserve is meant for budget deficits, significant economic downturns. To utilize the budget reserve for an ongoing need is a mistake, not only fiscally, it's a mistake of policy. I won't comment necessarily on should more money been used from the Healthcare Access Fund for this, which I would argue would have been a more direct connection, because the Healthcare Access Fund is the same problem. It's one-time money. And when we start doing huge parts of the budget out of one-time money, that raises other red flags. And we might get through this biennium and all go home and say we did great things. But at some point down the road, there are going to be concerns and there are going to be problems. The other thing Dr. Klimakidis said was that this is the longest post-war economic expansion that we've had. It's lasted for 8 years. And the rules of economics suggest that at some point it doesn't necessarily come to a crashing halt, but it starts to diminish. and even separate from any untoward actions out of Washington. So we play with a little bit of fire with this amendment, and I understand, Senator Dames, what you're trying to accomplish. I'm going to oppose the amendment. I just think if we're going to budget for these kinds of important issues, we should do it in a real substantive way and not utilize one-time money, and above all, not use the budget reserve for issues and expenditures that are far beyond the scope of what was ever intended legislatively by the budget reserve. Last comment, Madam Chair, is that budget reserve has been built up to a larger amount. And I know there's some talk about, well, if we have this budget reserve, I guess we're overtaxed or whatever. The budget reserve was built up for very explicit reasons. But if we go back to a budget reserve of smaller amounts, that the policy issue remains as to why you stay away from budget reserve. Last comment, Madam Chair, is when we look at the reserves, we also tend to lump in together the cash flow account of $350 million. That's there for absolutely emergency and emergency kinds of considerations. That was utilized during the absolute depth of the recession when MMB and Governor Plenty just did not know where the next dollar was going to come from through no fault of their own. So, Madam Chair, I appreciate the committee listening to me, Senator Dames. I know what you're trying to accomplish for very good purposes. This is just, I hate the phrase a slippery slope, but for lack of a better phrase, that's what this is, although we already started down the slope, so now we're kind of accelerating as we get to the bottom of the hill, or the slope.
Thank you, Senator Cohn. Senator Dames, would you like to comment about
well,
that?
my comment, and thank you for your comments, Senator Cohen, certainly well taken. I understand where you're coming from, but I also feel very confident that we're going to get the $100 million from the waiver, and very possibly get the Minnesota Comprehensive Health Access, or that fund, get the revenue, the reserves in that fund. So I don't think we'll end up touching this, but I can't say we won't. I certainly can't guarantee that, but I feel comfortable with that.
Senator Laurie.
Thank you, Madam Chair. Do we have a newly drafted fiscal note to the A22? It's actually pretty significant.
Thank you, Senator Laurie. It is significant, but we do, Mr. Naumann would like to go through the security plan, the premium security plan spreadsheet. There is no fiscal note on this, because this amendment, that just happened very quickly, but there is a fiscal note from Senator Benson's hearing in your packet.
Right, but
Mr. Naumann's going to go through the spreadsheet.
Well, maybe I could, real quick before he does,
Sure. Senator
highlight
Laurie.
what my issue is that I don't believe is covered in this spreadsheet, and we can have further conversations about it after working through the spreadsheet. But because as a set of budget rules, we cannot make assumptions based on receiving federal money that is contingent upon getting a waiver approved, a waiver that has not even yet been submitted. We can't put the state on the hook for that. And we had pretty significant conversations about this in Senator Benson's committee. And so the entire fiscal note is drafted with an assumption that the $180 million that we put in is the extent of the reinsurance program, because we can't book the savings from the additional money if the waiver is approved. So all of the other agencies are predicating their fiscal estimates on a 13 to 14% reduction in premiums. The way I see this fiscal note is we're making up that difference with state dollars, and so you would be, we would then be able to book a 21 to 23% reduction in premiums. Well, a 21 to 23% reduction in premiums that happens without the federal waiver loses us even more federal money. And then that's a real problem. At the 13 to 14% reduction, we were talking about $200 million of federal money foregone. So we put in, $180 million in each of 2 years, and we lose $200 million in federal money. That's not a good deal for the state of Minnesota. And what we're doing here is doubling down on a bad deal where we lose money from the feds. So this contingency actually makes things worse. And we did offer some other options. Once they repeal the ACA, I just have to say, 1332 waiver that is built into here, that is an ACA, that's the ACA. Section 1332 is a part of the ACA that the feds have on the chopping block right now, as is Minnesota Care, is a 1331 basic health plan waiver built into the ACA that is also about to go away. And so rating the Healthcare Access Fund right ahead of the feds cutting out their support for our Minnesota Care program is unwise. But let's step through the spreadsheet, and maybe I'm wrong. Maybe some of these effects are in here. I'm led to believe they're not. Well, let's step through the spreadsheet, and then we better talk about what is not before us.
Thank you, Senator Laurie. Mr. Naumann.
Mr. Chair and Senator Laurie, my apologies, Madam Chair. I don't know why I'm doing that.
That's okay.
That's okay. We look alike.
Madam Chair and members, the spreadsheet is designed to step folks through the difference between the spreadsheet, the fiscal note as is in the packet. And so effectively the lines 1 through 29 do that. Lines 31 through 64 reflect the bill as it stands if the A22 amendment were to be adopted, and then lines 66 through 77 plot a difference. So I'm going to skip over lines 1 through 29 in case unless there are questions about them. But just to reflect that is a reflection here of what the fiscal note is that was coming out of, I believe, Senator Benson's committee was the last stop. So members will notice that the payment on line 36 goes from $180 million to $300 million a year, so a $600 million amount for the MSHA grants for the premium security plan. Lines 40 and 42, 41, 42 are effectively the same as it was in the fiscal note. Then lines 46 through 51, I think, are the notable difference. Effectively, this is the transaction that takes $120 million each year from the budget reserve, puts it first in the general fund, and then transfers that money to the reinsurance account. Members will see the differences in the gold areas, total by fund/account, that the Healthcare Access Fund remains at $180 million a year. The budget reserve amount increases to $120. And so effectively the difference from a fiscal note perspective and what we would expect to see on a future fiscal note would be that the budget reserve would go down by $120 million each year, and that amount travels through the general fund before being deposited in the I'm going to get the name right, the reinsurance account in the special revenue fund.
I think Senator's okay. Senator Champion.
Thank you, Madam Chair. Maybe this is for Mr. Naumann. Again, I'd like to qualify this by saying I'm not on the healthcare committees, right? And so I just want to make sure that some of the questions I have, it just helps to put all the pieces together for me. So when I look at the amendment here, isn't it safe to say, and especially as we just looked at the spreadsheet, that we are going to spend or potentially spend $240 million? And it's even higher than that because you got to add in some other dollars. But I'm looking at this deal right here, and it's already saying that it's $240 million. So what is the absolute total amount of money that we're going to spend? And let's take out of the equation Washington, because if Washington doesn't do anything, I just need to have a real good sense of what we are putting the state on the hook for.
Mr. Naumann.
Mr. Chair, and Madam Chair, and Senator Champion, the total appropriation in this bill is $600,155,000. And that resource comes from two separate places. Some of it, a small amount, is $155,000 to the Department of Commerce to prepare and submit the state innovation waiver. You'll see that on line 4. The Healthcare Access Fund contributes $180 million a year for a total of $360. And then the budget reserve contributes $240 million for the biennium. And these are one-time transfers.
Senator Champion?
Thank you, Madam Chair. So what that seems to suggest to me, Madam Chair, is that I guess it underscores a little more what Senator Laurie was saying as pertains to a fiscal note and knowing exactly how much that we're going to spend, as opposed to just kind of going through the spreadsheet. Because from my vantage point, I just think that we as a committee, but also the public, needs to be really clear, ensure how much money that we're spending, and the second part of the question is who the money is potentially going to go to. Because now this is where I can be corrected also. But when I hear the term reinsurance, it usually means that someone is insured, but once they get to a certain cap, that someone else wants to be alleviated of their responsibility, and we as the state has to backfill that money. And so I want to make sure that I'm totally right about that. Maybe Senator Laurie can help me with that. Is that a true statement or wrong, or help me out?
Senator Laurie?
Madam Chair, Senator Champion, yeah, that's about right. It's insurance for insurance companies.
Senator Champion?
My last question, Madam Chair. So Senator Dames, you are the chief author of the bill. Do you believe that this is good policy, that taxpayers should be on the hook for lining the pockets of insurance companies? And if so, please articulate with clarity why you believe that to be true.
Senator Dames, actually, I would like your definition of reinsurance. We had Senator Laurie's, and I should have asked you what your definition of reinsurance was.
Well, thank you, Madam Chair.
Along with Senator Champion's question.
Yeah, thank you, Madam Chair. Reinsurance is when an insurance company reaches a certain point. There is usually it's a attachment point in health insurance. It's an attachment point to where the reinsurer would step in and they would pay up to another level, and then the attachment point or the reinsurance would go away. In this bill, the reinsurance, the attachment point would be $45,000 per individual in claims. That would go to $250,000, and in between the $45,000 and the $250,000, the state of Minnesota would be the reinsurer, and they would pay 80%. After $250,000, then the provider, the insurance provider, would then kick back in and pay. As far as if I feel that we should be putting the public on the hook to deal with insurance companies, I think we have to look at where we're at today. Not going to get into the facts of how we got here, but we know where we're at. And we know what happened last year in the individual market. The individual market collapsed. And we've got to do something to try to bring that individual market back to a competitive position. And I feel very comfortable doing this because you can refer to it, you put the taxpayers on the hook to bail out the insurance companies. We can use any terminology you want. The matter of fact is we have a lot of people that are not going to have access to health insurance, and this is one way to do that. You can do it through the private industry, or you can do it through the public. I feel the private industry is going to offer us a lot of opportunities. I feel it's going to increase access to the provider, to the networks. I feel it's going to increase access to the various companies because I do think that this will attract the insurance providers, the insurance companies back into the marketplace. So yes, I'm comfortable with doing this, and that's why I'm carrying this proposal, because I am comfortable with it.
Madam Chair?
Senator Champion?
So Senator Dames, can you help me understand how you are guaranteeing more access? Because based on your definition, you indicated that the individuals are already insured. So they already have access. They already have health care. But when it gets to a certain level, we are now saying that the insurance company wants to drop out and that the state then steps in to continue to provide care for these individuals. Help me understand how that's expanded access, because it appears that they already have access.
Thank you, Madam Chair
Dames.
and Senator Champion. First of all, I did not say guarantee access. So I said I thought it would expand access, and I believe it will. I did not say guarantee, just for the record. Why do I think it'll guarantee access? We have folks in rural Minnesota that have very limited to access to the medical community and the networks. And I feel that this will open that up so they have more opportunities to be in with the companies. Will step in and be in more, and we'll open up the opportunities for networks. So I think they'll have better access to our local hospitals. I also think they'll have more access to the insurance providers, because did you want to have communication? I'm talking to you, Senator Champion, and so I think you're trying to talk to somebody else. So if you, I can stop if you want to have communications.
Well, let me tell you, Senator Dames, thank
Senator
you for being
Champion.
so, Madam Chair, thank you for being so thoughtful, but I actually have the ability to multitask. That's something that I really do know how to do. So I can actually listen to you and regurgitate right now what you just said.
Good.
And then articulate where I believe the flaws are in what you just said, while communicating with Senator Marty as to whether he is getting ready to ask the question or not, and whether he wants me to be quiet. So with that being said, you have my undivided attention, and I'd love to hear how you believe this would increase access for greater Minnesota, even though these individuals will already have access, and how this backfilling of the insurance company's responsibility is good for greater Minnesota. So if you can help me understand that, that'd be
Certainly.
Senator
Madam
James.
President, thank you, Senator Champion, and I'm glad you can multitask. I appreciate that. Now that we're past that, they may have access, but it's limited. You may, in rural Minnesota, you may have, some of our folks only had access to one insurance provider, and a lot of times that wasn't in their area. They also, in a lot of cases, didn't have access to the hospitals or the network in their area. And I believe that if we bring more insurance providers into the marketplace, that that'll offer more opportunities for individuals to buy policies from different folks offering them. Plus, I believe it'll offer more opportunities for people to get into the networks in their local communities.
Senator Benson.
Thank you, Madam Chair. And to Senator Champion's point, the health insurance market is different than a lot of other insurances we might be familiar with. The federal government provides terrorism insurance, for example, because nobody knows where that's going to happen, when that's going to happen, and in no way am I trying to parallel these two things, but just to understand it's different than automobile insurance, for example, where we have relative predictability and underwriting based on risk. In the health insurance market, there are a few people each year who are going to be really expensive in the individual market, and they have the opportunity to change products with every enrollment year. So every carrier that's going to offer in the market has to assess how many of those really expensive people they're going to have to provide coverage for. And so they end up accounting for that in their rates. By having a reinsurance product that says we're going to give you some certainty that if somebody goes over this amount, we're going to help backfill and we're going to spread that cost over a larger economic function, in this case, the state of Minnesota, that lets those insurance providers say, all right, I know, so no matter how bad this gets, here's my risk. And they don't have to account for sort of the off-the-charts unexpected risk that happens when you have people moving from product to product. And so that's how reinsurance becomes effective in a situation like this.
Senator Champion, response?
Madam Chair, let me just say that you've been very thoughtful around allowing me to ask 50,000 questions here. So maybe I'll defer to someone else down there, let them ask a couple of questions, and maybe that'll help bring some clarity to what I see as a kind of challenging issue this morning.
Thank you, Senator Champion. Senator Marty is on it, and then Senator Lori.
Thank you, Madam Chair. And comment partly to Senator Champion and others. But the other day in Finance Division, Senator Laurie had an amendment that I think would have guaranteed, because I think Senator Dames is right. We're putting $300 million a year in, setting it aside for this reinsurance, on top of the $300 million we put in to subsidize the premiums one time. We're now, with this bill, with this amendment, would be up to $900 million to temporarily fix, we hope, 5% of the market. The other 95% of the public is not touched by this. This is just for that 5% of the market. We're close to $1 billion now. And this doesn't, as Senator Dames said, he didn't want to use the word guarantee. I would argue it does not guarantee that people in every county are going to have a plan they can buy, period. If they can afford it, they may not have one option available. And Senator Laurie had the amendment, at least for Greater Minnesota the other day, that they could have Minnesota Care buy-in, which would at least guarantee everybody has some plan they could buy, arguably a less expensive plan at that. So I would say the first point I wanted to make is that this, after putting $900 million in, we still don't know that people are going to have, in every county, have a choice. The second point I would make is in response to Senator Benson's comments about how, yes, and I think it's appropriate to look and compare it to other types of insurance. And you mentioned terrorism insurance. I'll mention another one, the nuclear power industry. We wouldn't have a nuclear power industry without the Price-Anderson Act, where the federal government is insuring it. In effect, we don't call that insurance, though. We just say we're dealing with that in a different way. And I'd make the case that why are we trying to deal with saving an insurance market when what our problem should be is trying to make sure people in every corner of Minnesota have access to health care? Because even if this $600 million in this bill does get every county to have at least Blue Cross or somebody offering a plan, we still have what the cost of the plan is, the high rate of deductibles, as I think everybody here recognizes, the networks are so small that a lot of people can't go to their doctor. So it just strikes me that at the time we're getting close to $1 billion for a temporary fix for 5% of the market, we ought to be looking at a different approach.
Senator Dames?
Well, thank you,
Response?
Madam Chair. We did, as you said, Senator Marty, we did have that discussion the other day, and I think we have to keep into account how we got here. And we know how we got here, and I'm not so sure that, as you say, doubling down in trying to keep the insurance industry in the marketplace. I would kind of look at what we're talking about doing with Minnesota Care is a doubling down also. So I'm comfortable with this position. I'm comfortable with moving this forward, and I certainly appreciate your input and certainly understand where you're coming from, but we will have, you and I don't agree with how the process would go forward, but thank you.
Senator Laurie?
Thank you, Madam Chair. So I'm not going to offer any amendments today, but, we have had several conversations about this through the healthcare committees. And, a big piece of this, Senator Dames keeps mentioning how we got here and whatnot, and a big piece of this is predicated on this nostalgia for Minnesota's pre-ACA nirvana. And, one of the things that I need to just say is while we were having one of those conversations on the Minnesota Care buy-in, we had 15 testifiers come up, and it was organic. I did not organize this. I didn't know these individuals. They came up and they told their stories of nightmares with our healthcare system and our health insurance system about kids with leukemia who were unable to navigate the system, people who had reached their lifetime limits and had nowhere to turn for help in paying their premiums and paying their claims. People with real life stories that literally, were bringing me to tears. We had some very, very serious issues. That said, if we want to pretend like that was nirvana and we want to get back to it, I just need to say it was predicated on taxes. It was predicated on taxes that have been repealed. The way we used to pay for high-risk populations was through an MCHA assessment that was put and spread across the entirety of the fully insured marketplace. And I know that Senator Benson understands this. As she first introduced this bill, this concept, it was paid for by a similar MCHA assessment. I actually pledged my support for this if we paid for it the right way, through an MCHA assessment, spread the cost of this 2% of the high-cost cases across the entirety of the fully insured marketplace. I realize that it's gone from about 1.4 million lives across Minnesota to about 1.2 million, but it's still much larger than the 180, 190,000 lives in the individual market that truly can't sustain the premiums that occur if we do nothing. We need to do something. I think reinsurance is a valuable tool to consider, but it has to be funded the right way. It has to be funded by, and if it's going to be turned over to the insurance companies to manage in the way that this is, they need to have some skin in the game, or they're going to take advantage of the people of Minnesota. I don't think we even have the tools in here for the Department of Commerce to make sure that this money that the public puts in to insure the insurers actually comes out of individuals' claims. I mean, I'm very dubious about that assumption that is made. And you know, to Senator Marty's point, this is over $900 million now. If we were to pass this bill as it is now before us with the amendment that was just added, it's over $900 million between the Senate File 1 investments of $325 and this $600 million for 5% of the marketplace. And I would be remiss if I didn't say 20% of Minnesotans rely on our public programs for their access to health care and health care services. And the feds have, you know, proposals on the table to cut literally starting point $1 billion a year out of our supports for this 20% of Minnesotans. And you're using the Health Care Access Fund that is there to help low-income populations gain access to health care. It's there to help our elderly in nursing homes. It's there to help our disability community, communities that we've all made promises to, promises that you're not going to be able to keep if you raid the very funds that are there to protect these vulnerable populations who look to us to help make sure that they have a decent life. To take this level of public money and turn it over to the insurance companies with no promise that there even will be products, absolutely no promise that, I don't know, Senator Dames, where you come up with the idea that this is going to get them to fix the networks. In fact, front page, top of the fold this very morning is that, you know, Children's Hospital is pulling out of the Blue Cross Blue Shield network. 70,000 Minnesotans losing access to yet another provider. And there is nothing in here other than you're saying, I think this is going to do it. There's nothing that you can point to in here that says that networks are going to improve, that access is going to improve. There's nothing in here that gives us any sort of a guarantee that insurance companies are going to put out products in these areas that are very difficult to serve. You know, the numbers of enrollees are small and the numbers of providers are small, and they're just not terribly competitive marketplaces, and the insurers already pulled out. I mean, the Blue Plus networks that are available as the only option in large swaths of the state of Minnesota are by design narrow network products, and you've got nothing to try to
Madam Chair.
build that into a better place.
Madam Chair, just a point of information.
Senator Fischbach.
Is this to the, we're still on the amendment?
Yes, we are
Is
on
this
the
to the
amendment.
amendment?
We have not
Because I thought
adopted
the amendment was more focused on the money as opposed to,
Okay,
Yeah.
Madam Chair, I thought we did adopt the amendment that,
was that?
No.
I mean, consider that sort of some of my closing statements.
So then we'll
I'm not
expect
going to rail
less next-
forever. I'm not going to
Okay.
keep this going. This was getting beyond the amendment, so let's.
Senator Lori, thank you,
Thank
and we will get back to you for closing, and thank you, Senator Fischbach. With that, there are some technical changes to the A22 amendment that we need to go through, Senator Dames. Mr. Naumann.
Madam Chair, it would be my recommendation on line 1.1 to strike deposited into the general fund and replace with transferred to the budget reserve account under, 16A 152, subdivision 1A.
Mr. Nauman, could you repeat that, please?
Sure. On line 1.11, strike deposited into the general fund and insert transferred to the budget reserve account under section 16A 152 subdivision 1A.
Any questions on that technical amendment? Okay. Senator Dames, you're fine with that
Yes.
technical amendment? Okay, we're just
Madam
going to
Chair, thank
incorporate
you,
that
yes.
into the A22 amendment. Further comments on A22 or questions?
Madam Chair.
Senator Cohn?
So, Madam Chair, let me just make another couple of comments about the A22 amendment.
Thank you.
And try to just maybe capsulize my concerns. And Madam Chair, I'm going to offer a criticism, not of this committee, but of the Finance Committee generally over the years, whether Senator Miriam was the chairman or myself or Senator Roebling, yourself. I think one of the problems we have in this committee is, the caucuses will take a look at the totality of the budget, but we really haven't done that publicly with this committee. And I had given some thoughts to how we might change the institutionalization of this committee relative to that. But I think the A22 amendment offers a perspective on why I've had those concerns. We start the year, and with the most recent forecast, with a little under $5 billion in monies available, whether good, bad, and different. A budget forecast surplus of 1.650. Budget reserve of 1.930, I believe healthcare access at 1.360. Obviously, there's some other funds, some smaller funds that are in there. That gives you about $5 billion. We have spent, I believe, if Senator Dames' bill passes with this amendment, we will have spent out of this committee almost $800 million of that budget total. But again, that anticipates we use approximately $3.3 billion of one-time money through the budget reserve and the healthcare access fund. Senator Laurie has pointed out why the A22 amendment is based on supposition. I don't know, Madam Chair or Senator Dames, if anybody within the Senate has been in touch with folks in Washington. And one of the problems we do have is you have an administration that's been in office for several weeks, and as has been quite evident, is just getting started. We don't have a lot of seniority within the congressional delegation. I think the most senior member, Congressman Peterson, is very senior within the House. He's in the minority. So I don't know if there's been any discussion with Washington as to how valid an assumption is relative to utilization of a supposed waiver. But again, as Senator Laurie points out, if the waiver is not in place and we fall back on the budget reserve, then we're just eating things up. And we're doing so on a one-time basis, which I think holds out an illusory hope to Minnesotans as to what's going to be there or not be there. I know my strong recommendation, and I haven't talked to anybody in the administration, obviously. I'm sorry, Madam Chair. I don't know what the plan is, and it's, at this point, none of my business. At some point, it becomes my business. But in terms of if the expectation is that this bill will be passed and sent to the governor, as was Senator Benson's bill, if this bill in this proposed shape with the A22 amendment goes to the governor for signature, I certainly would strongly recommend that he veto the bill, because now you are going to be putting together a bill that fiscally is illusory. And I just think we go down not a wrong road, we go down potentially a dangerous road. Last comment, Madam Chair, is we all know, and this committee is a senior committee, that putting budgets together are tough. I might, as an individual legislator, object to decisions by this committee, the majority, or the majority on the floor. But if you were to take, just as an example, and I hope she won't jump up and down, this is a hypothetical, Senator Nelson, the K-12 budget, which has $17 billion. Let's take 10% from that, or 5%. 5% from that budget is $850 million. Now, we know the reality around this place, which is that we never cut the K-12 budgets. The question is, how much are we going to add to a K-12 budget? Even at the depth of the recession, the decision was to pass a significant shift. We actually didn't take money away from K-12 budgets in that respect. So I'm assuming we're not going to take 5% away from Senator Nelson's budget as forecasted. We've obviously had some ideological differences relative to the Health and Human Services budget, and maybe that budget target is going to look different than what the DFL minority might propose. Those would be real dollars, however, and ongoing dollars. I might object to those dollars, but I would at least be able to say that fiscally it works. I just am very concerned that we, with the A22 amendment, start going down a road that is just going to be very, very difficult for us if this continues. And so obviously I oppose the A22 amendment and would ask for a roll call on the amendment.
Roll call has been asked. Roll call will be given. Senator Laurie?
I won't belabor it, but I do have two very simple questions. Senator Dames, do you know how much federal money we lose under the A22 amendment? You know, updating the fiscal note, if they were to have updated the fiscal note, how much additional federal money is at risk?
Thank you,
Senator Daines.
Thank you, Madam Chair. Senator Laurie, I'd defer to Mr. Naumann.
Mr. Naumann?
Mr. Chair, Madam Chair and Senator Lurie, I don't believe even the original fiscal note spoke to that point. I could be corrected if that's the case, but we'll get more information.
The
Senator Laurie?
Madam Chair, the original fiscal note did. It's on page 12 of 20, and it shows about $200 million of losses over the period of federal money flowing into the state of Minnesota at the $360 million state investment. And that was predicated on, that's if it's 14% reduction, which is all they could book because we don't have the federal waiver approved. And I guess my second question, if we don't know how much is lost, do you care how much federal money you're putting at risk to support the state of Minnesota and our services to low-income Minnesotans needing access to health care and elderly and disabled who look to us for their care?
Senator Laurie, that's a little, that's
could-
kind of out of order here. And
Madam Chair,
to the
may I-
A22 amendment, I think, is where we're at. Senator Benson?
If I may, and if you want to end the discussion, Madam Chair, I will. But to that point, Senator Laurie, putting a contingency nullifies the whole purpose of providing market certainty. And it is an awful catch-22. But if we put something in here that makes this contingent, makes the whole thing contingent on a federal waiver, then it has the effect of doing nothing in the reinsurance market, because nobody will be able to plan for anything, and it is an awful situation. And you are right to address it, and you are right to raise it, and I wish there was a way I could fix it. But the very nature of trying to create certainty is undone by a contingency that would create uncertainty. And I know the number is huge, and with a bigger reinsurance pool, the number is even bigger. But this is nearly unresolvable, given the level of intercession we have from the federal government at this point, and we don't know what's going to happen next. I cannot give you more certainty by putting a contingency in this bill.
Madam Chair,
Senator Laurie?
I'm sorry if I was getting close to the edge.
you.
I don't believe I was over the line. My point is, we're being asked to vote on a very substantial change in the funding of what just left our Health and Human Services Committee, and it's not reflected on any of the material in front of us, what the ramifications and the risks are. I mean, it's troubling to be asked to vote on this without even having the information before us. That's a very troubling position to be in, and that's what prompted my question, and I'm sorry if it was getting close to questioning motives. I didn't intend it to be, but we should have information before us before being asked to vote for something.
And Senator Laurie, I do appreciate that very much, and I do know, and I have been told that this is actually my first time on finance, but that this is not uncommon to have not a fiscal note in its final form be presented in front of the committee. And I just want to say that we all care. We all come to the table with a different way of solving this issue that has been dropped in our lap. There is, the unknowns are mounting and growing every single day, especially coming out of DC, but we are doing the best we can. We come to the table with different opinions, and we respect that. So thank you very much, Senator Laurie. A roll call has been requested. A roll call is granted. Senator Cohen?
Madam Chair, very, very briefly. I just want to indicate that over the years, I can't think of the last time I asked for a roll call on an amendment in a committee. I do have some strong feelings about this, and part of it is to telegraph, at least on the part of some of us, that a concern as to funding, not obviously the question of motives or anything. I don't know that I ever said this in this committee previously, or if we go back to 11-12 when I was a minority member of this committee. I've never, this isn't meant as a threat, but I do think there needs to be a message sent to the administration that we should be very careful about how we're putting together state budgets, and that's why I asked for the roll call, which again, I don't think I've done in a long, long time.
Thank you, Senator Cohen. Mr. Naumann, to that.
So, Madam Chair, Senator Laurie, I have done a little bit of digging. I think I have the numbers that you were seeking previously. So if you add up all the total, I believe that this bill would change from a 13% in the original fiscal note to between 21 and 23%. And I think at that level, the loss in federal BHP funding would be between 287 and 314.9.
Mr. Naumann, could you please repeat the number?
Madam Chair, Senator Fischbach, between 287 million and 314.9.
Senator Champion.
Madam Chair, Senator Champion, this would be the change in federal BHP funding that Senator Laurie was speaking to earlier.
Okay. Okay.
Madam Chair, Senator Marty, maybe the microphone is not picking up my voice. I'll try to speak a little bit louder. So the question that Senator Laurie asked was at the new higher amount that's been appropriated in the A22 amendment, what would be the reduction or the change in federal BHP funding? And over 3 years, members will note that on page 12 of the fiscal note that's in the packet.
Well, just over 24 months. So 6 months in one fiscal year, 12 months in another fiscal year, and 6 months. So over a 24-month period.
Okay. Madam Chair, Senator Laurie,
Mr. Naumann.
you are correct. The chart displays 3 fiscal years because it would occur over 3 fiscal years. I didn't mean to imply that it was a 3-year loss, but you are correct over the 24 months. It just happens to slop into 3 different fiscal years. So the question is the projected change, and we have some preliminary data that would imply a $287 million loss in federal BHP funding if the percentage is 21%, and if it's a 23% loss, then it's or reduction, then the loss would be 314.9. Madam Chair, Senator Marty, is that a little bit clearer?
Great. Great. Okay. Senator Benson renews her motion on the amended.
Madam Chair.
Oh, I'm sorry. Senator Nelson, I'm sorry.
Thank you. Thank you, Madam Chair. Well, we've sat here and heard a lot, and a lot to take in, and it is clear that everyone here is very concerned about making sure that Minnesotans have health care and health insurance. But I would just like to mention a couple things. So there are a lot, we've talked about unknowns, but there are a lot of knowns. We know that premiums have skyrocketed. We know there are Minnesotans who have maybe one health plan, if they're lucky, to choose from, and more are leaving every day. And we know that Minnesotans can't get to the doctors of their choice. So it's a huge concern. But there are a lot of unknowns that were addressed, and we don't know what the feds are going to do. I don't even know how we can say what we'd be losing in subsidies from the feds when we don't know what the feds are going to be doing. So we're all really hamstrung here by not having the information that we would normally like in making these decisions. But that is what we do. I'm going to be supporting this amendment, but I do think that there are still concerns that need to be addressed. I'm not confident that we are adequately spreading the risk, and that's what insurance does. Insurance is the law of large numbers, and it is about properly assessing risk and then assigning premium or subsidy to go with it. I'm not confident that we're at that point yet where we're adequately assessing risk, or maybe I should better say adequately determining how that risk should be paid for. But I do think we need to move forward on this. We can't dilly-dally any longer, and we have to make the best decision with the information that we have in front of us, as much as it might be incomplete at this point.
Senator Nelson, thank you. The insurance is the law of large numbers. That's very good. That's the first time I've heard that.
Just one question.
Senator Champion.
So, Senator Dames, I'd like to know if what Mr. Nauman has articulated is true, that there will be losses by way of $287 million to $314.9 million. What happens if we were to face those losses? Then what happens to this insurance coverage and insurance access in the future? Do we then have another plan to backfill even those losses? And that's to the amendment. I'm just trying to understand whether this would be a good idea, or maybe we should take a moment to relax and really try to ascertain or figure out as much as possible what's going on in Washington. And last but certainly not least, I'd like to know if Senator Nelson has had an opportunity to talk to the Mayo Clinic about their thoughts about this reinsurance bill.
Senator Dames.
Thank you, Madam President. And Senator Champion, you are right. We don't know the unknowns, and I don't have a backup plan because we don't know the unknowns. So it'd be really hard to put a backup plan in, not knowing the unknowns. However, our people in rural Minnesota or in the metro, wherever you're at, that do not have insurance, don't have adequate access to the networks, and don't have adequate access to insurance companies in their marketplace, their life goes on, and so we need to be doing something trying to address that. I understand where you're coming from. I wish we had magic bullets, but we don't. We don't know what's going to happen, and so we have to move forward with what information we have. Thank you.
Senator Nelson to Senator Champion's question.
Yes. Thank you, Madam Chair. Senator Champion, yes, you can be very sure that I've worked extremely closely with our state's largest employer, which happens to be the Mayo Clinic, which is in my district, very closely. Thank you.
Senator Eaton.
Thank you, Madam Chair. I guess
This is, and excuse me, Senator Eaton, we are still on the A22
Yes.
amended, and we have a roll call requested, so.
I just wanted to comment that I think the A2 amendment is very ill-advised. I would not do my own personal finances that way, and I really do have concerns about the risk this does to the budget for the state of Minnesota. My calculations are we could be looking at $1.2 billion cost here if we do lose the funds from the federal government. And I just can't support this.
Thank you, Senator Eaton. Senator Ingebrigtsen.
Thank you, Madam Chair and members. As Senator Nelson said, a lot of good discussion, a lot of what-ifs and presumptions and so on and so forth. And even my gentleman to my left said he's not single-dimensional like the old Norwegian here is. He can do more than two things at one time. I can't. I'll admit that. But I do have a good memory. And I do remember, not that long ago, how much of in a hurry the state of Minnesota was to get on the previous administration's health care. I support this amendment because a lot of good work has gone into trying to fix what we ended up doing was breaking the health care in not only Minnesota, but it sounds like the whole nation. Senator Cohen mentioned the administration should seriously look at this. Well, folks, it would be pretty presumptive on his part, I think, to think that Governor Dayton would veto something like this when he's the one that came out and said before November 8th, the Affordable Care Act is no longer affordable. And so Senator Benson and Senator Dames have been working very hard with their committees to get to this point to try and fix the mess that we got into here 6 or 7 years ago. And it's not going to be easy. And I think this is just one step of many to go to fix what we were in such a hurry to take care of 6 years ago. It turned out to be a disaster. So thank you, Senator Dames, and I support your amendment wholeheartedly.
Senator Western. Thank you, Senator Ingebrigtsen.
Madam Chair, just to the amendment, and I guess not to drag it on, but I guess I'm hearing lots of critique of where the money is coming from, and maybe Senator Eaton or Senator Laurie could just offer to the committee where they would rather take the money from. That would be just at least
Senator
insight.
Laurie, and we are going to start losing
Madam
members
Chair.
here shortly, so we are going to have a vote on this 822 fairly quickly. Senator Laurie.
Absolutely. And Senator Westrom, maybe you weren't tracking last time. I did offer an amendment in Senator Benson's committee and pledged my support
Madam
for
Chair,
this bill.
what do you mean tracking last time, Senator Laurie? I've been listening to this whole discussion.
Okay.
So if you said
Okay.
something here and
Well,
I missed it, I apologize.
I mean, I
But
just-
wasn't
Senator
in Senator
Westrom.
Benson's.
Senator Westrom, Senator Laurie, hold on now. Senator Laurie.
So, to reiterate, I offered an amendment and pledged my support for this bill if the amendment went on, where we reassessed the MCHA assessment and paid for it in that manner, so that the health insurance companies had some skin in the game for the public money that we're turning over to them. That's how MCHA was funded, you know, in the pre-ACA world, our high-risk pool. This is a virtual high-risk pool. If we want to fund it in that manner and spread the cost of this, you know, 2.5% of the marketplace that incurs, you know, nearly 50% of total claims, we should spread it across the bigger fully insured marketplace, or even try to find some other ways to spread it even broader than that. I'd be open to. But if we had adopted that, I would have been willing to support it. But paying for it out of the Healthcare Access Fund in the way that this is done puts the state at too great a risk, and spending down the reserves to make up any balance if we lose the federal supports is an even greater risk than that. So there are ways to pay for this that I do think should be considered, and I will reiterate, I think that reinsurance is a valuable tool to be considering, but it needs to be done the right way, and this really turns over all of the control to the health plans. Doesn't do it in a way where I think the Department of Commerce has the tools that they need to make sure that ratepayers actually get this public investment taken off of their premiums. And they're completely in the driver's seat. We've extracted no promises from them to make plans available in every county. We've extracted no promises from them in terms of improving networks that really don't work for Senator Dames, your constituents. They don't work for my constituents. Okay. We've got nothing, and we've turned over everything to the insurance companies. We're asking them again, please take our $1 billion and make it work. And I'm troubled.
Okay, thank you, Senator Laurie. We are going to do this roll call. Senator Cohen requested a roll call. The chair votes aye. The clerk will take the roll.
Chair Rosen votes yes. Benson.
Aye.
Champion.
No.
Cohen. No. Eaton.
No.
Fischbach.
Yes.
Ingebrigtsen.
Yes.
Limmer.
Yes.
Laurie.
No.
Marty.
No.
Nelson. Newman. Westrom.
There being 8 aye votes and 5 no votes, the motion prevails. Amendment is adopted. Members, we have closing comments. Senator Dames.
Thank you, Madam Chair and members. I don't know if you want me to go through the other sections. I think we've covered the other sections. I can just touch on them quickly here. Section 1 is just talks about the Healthcare Association Board. We already talked about that. Section 2 just calls it the Minnesota Premium Security Plan, and it shows that the Comprehensive Health Association, that board will be the governing body. It talks about who's eligible for the reinsurance. That would be the private insurance companies, nonprofit health plans, and HMOs. Section 3 talks about the duties of the commissioner. Section 4 talks about the attachment rates, the reinsurance cap, and then the co-insurance. We did talk about that. It also talks about the auditing procedures, how the providers would be paid, and the timelines on that. Section 5 goes into the counting, reporting, and auditing. And in the Commerce Committee, we had some changes there on the data privacy, so that's been covered. Section 6 through 8 cover the funding mechanisms, and we went through those. So the majority of the bill is in the funding part of it, and that's where the majority of the discussion was today. So that would be my closing comments, Madam
And Senator Dames, I do have a comment. Is there a time frame on this? Is there's some urgency to this this bill? Can you please explain that?
Yes, we do need to move this bill forward. In order for this to work, the Commerce Committee had requested it. They'd hoped we'd had it by the middle of March, but certainly by the end of March, we have to have it off of both floors, through Conference Committee, through the Governor's Office, and over to the Department of Commerce. So they could go through this, put this together, get it out to the plans, so the plans can get back and have their numbers and stuff back in early June, so that they can have those numbers locked in by the end of June. So yes, there is urgency here if we're going to get this taken care of.
Thank you. Further questions or comments? Senator Lohr.
Madam Chair, and I will be brief, but, you know, I mean, I've heard several times here, we don't know what the feds are going to do. There's a lot of uncertainty around here. Senator Dames said, I think, you know, we don't have a backup plan based on what the feds do. I just have to say this here is assuming that the feds do only good things that help Minnesota's budget, that the feds only send additional money to Minnesota, and that they don't make any cuts. And everything that I've seen at the federal level is actually cutting deeply into the programs that we serve. And if we want a backup plan, that backup plan is going to be contingent on the Healthcare Access Fund that has been our state source of revenue to support low-income populations, making sure that we maintain access for these populations. And when we use that fund in this manner, you know, it really moves us even further from a backup plan that I just really worry we are going to be in desperate need of in a very short time period, and our state budget is going to be in very serious trouble. So I'll be voting no today.
Thank you, Senator Lohr. Further comments? Senator Benson.
Madam Chair, I'll move Senate File 720 as amended be recommended to pass and sent to the floor.
Senator Benson renews her motion. Roll call has been requested. A roll call will be given. Clerk will take the roll.
Chair Rosen.
Chair, aye.
Benson.
Aye.
Champion.
No.
Cohen. No. Eaton.
No.
Fishbach.
Yes.
Ingebrigtsen.
Yes.
Limmer.
Yes.
Lori. Marty. Nelson.
Yes.
Newman. Westrom.
Thank you.
There being 8 yes votes, 5 no votes, the motion prevails. the bill passes and sent to the floor. Thank you, Senator Dames.
Thank you, Madam Chair and members.
Members, plan on meeting next Tuesday. We have some bills, and then the following week, we will be seeing a lot of each other. The meeting is adjourned.